So we have heard from plenty of folks who have had this virus and recovered. We've heard from families who've lost loved ones to the virus. And we've certainly heard from many medical experts on the ever-evolving situation with COVID-19. But not many experts in infectious diseases can say they understand it like this next man, who not only studies it, he can now say he lived through it. Dr. Michael Saag is with infectious diseases at the University of Alabama Birmingham Hospital. And Dr. Saag, you got sick. Tell us about kind of what happened and your treatment.
It was a pretty miserable experience. My son and I had driven back from New York, where he lives, and we brought his dog back with him on a Friday night. And when we got here, he spiked a fever. We said, uh-oh, I think you might have COVID. Isolated ourselves. The next day I became sick. And for my illness, it started off mild, not too bad, a little cough, some muscle aches, fatigue, and interestingly, loss of smell, which is a common feature of COVID-19. We got tested on that Monday. We both tested positive. His symptoms went away, but mine persisted until that Wednesday, and I thought they were going away. And that Wednesday night for the next 8 nights, it was a cycle of feeling okay in the morning, mid-afternoon to late afternoon, getting very sick, having fever, chills, feeling horrible, not being able to sleep much at night, waking up in the morning and things are better. So I kind of think, okay, I got this beat, and then it just repeats. So I called it Groundhog Day disease because it kept coming back over and over and over again. And it's just a miserable feeling. Finally, it just, on the day 14, decided to go away, and I was very happy about that.
Okay, now with being in infectious diseases and knowing how serious this is, how long ago was that? And why didn't you think maybe you should go to the hospital right away?
Well, initially I wasn't sick enough to go to the hospital. As my fevers started to hit, what I was watching was my oxygen level. I had a pulse oximeter at home so I could see what my levels were. There's really no reason to go to the hospital unless you're short of breath. There's not much they can do for you. They just evaluate you, send you home. But I watched my breathing like a hawk. Of course, I didn't know on any given night whether I was going to deteriorate. And that's really the horror of this disease, that each time you get sick, especially at night, and that seems to be its MO. Every time that illness comes on with a vengeance, you don't know if you're going to deteriorate and need help with oxygen and perhaps even a ventilator, which is what everybody's fear is, or whether you can survive the night. So that was 8 nights in a row of pure terror.
Because most of us do not have the medical expertise that you do, and we live where Mayo Clinic is, and a lot of healthcare workers are going to see this, but so many people are going to be more apt to go and want to be seen in an emergency room. I mean, people are going now with a cold because they are afraid that it's COVID-19.
That's right. What we've done here, and I'm not sure what Mayo's doing, but what we've done here is we set up a telemedicine line, and the telemedicine line is where people can call in. We evaluate symptoms over the phone. We even have a scoring system for that. And then the patients who call in get triaged. They might just get reassurance that there's no evidence from their story of COVID-19. The second group has symptoms that are consistent, but they don't sound ill. And then what we'll do is we'll send them in to be tested. And now we've established an outpatient COVID clinic where we will evaluate them, get oxygen levels, and that's all done daily. If they're sounding really sick through the telemedicine visit, then we have them go to the emergency department, or we may even admit them directly into the hospital, depending on what their symptoms are.
Okay, that is a lot of what is happening here as well. So having been infected, how has this changed the way you see this virus, and has it changed anything with your perception of it?
Well, yes, I'll start with the second part. My perception has changed dramatically because it's one thing to read about this thing as a clinician and understand the symptoms, at least in the abstract, and a different thing to go through it. And it's very horrifying to go through it. So now I'm truly sympathetic to the patients that I see in the COVID clinic. And I think it helps them to talk to a provider who's actually had it. I'm not suggesting that every provider get this, trust me.
That's
nobody wants this.
Right.
But I think the perception has changed for me. As far as what to do about it and how my thinking has evolved, I think that the thing that's really jumped out at me the most is that the stay-at-home orders that a lot of states, most states have embraced, they're actually working well. The curve is being flattened. Everyone asks the question, well, when can we let this go? That's not the right question. The right question is, how do we retract? Because my opinion is, especially after experiencing this, is that this virus is extremely contagious, more so than the common cold. So if we just pick a date, June 1st, July 1st, we say, okay, we've got this managed, let's take back the stay-at-home orders, and people go about their business as they were in February, we're just going to have another spike in cases. Why would we not? Mm-hmm. But people are still susceptible. The virus is still contagious. People will start traveling around the country. And as we say in a lot of infectious diseases, and especially this one, this virus is not eliminated anywhere until it's eliminated everywhere. So we're just going to have another spike. So what we need to be thinking about right now is, how do we retract? And I think what we should be doing is initiating case contact tracing procedures. Treat this as if it's tuberculosis. Get the health departments involved and aggressively test, quarantine, isolate, so that the people who don't have it will be out in the community, and those people who do have it will be pulled back, and would have an aggressive program to keep things at bay.
Dr. Saag, my governor is going to be very, very happy to hear you say that, because he is catching a lot of flack from the business community. People want to get back to work. This is crippling our economy. It's crippling the economy of every state in this country. We get that. But the fact of the matter is, like you said, it is not going to be gone anywhere until it is gone everywhere. And what he has suggested is that, because Mayo Clinic is leading the way with serologic testing, and once we can kind of distinguish who has the antibodies and who would be immune to it, we can't be letting people out there because of the health of everyone else.
Tip of the hat to your governor. Your governor's thinking about this the right way. We're in an infectious disease pandemic emergency. Staying at home is our patriotic duty. Staying at home is our patriotic duty. We should be doing this to protect ourselves, our family, and our community. Failure to do that puts everyone at risk. So your governor is doing the right thing. A lot of states are now doing the right thing. The question of what happens next is what we should be critically thinking about at this exact moment, and prepare for it.